Joining us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, good to see you as always. So what are your thoughts, your concerns perhaps about what recommendations may be coming from this new panel?
Well, good morning. You said it in the tee-up. There is going to be a revisiting from this new group of advisors on this advisory committee for immunization practices on 3 vaccines. That's what we're expecting, and so to pre-bunk it to some degree, this is the measles, mumps, rubella, varicella combination vaccine that we don't talk a lot about. It's also the hepatitis B vaccine, as you pointed out, and COVID vaccine for children. The chilling effect here, Willie, is, if we were, for example, delaying the hepatitis B vaccine in any absence of any reason to do so, there's a reason we give it at birth. It's the so-called birth dose. Within the first 24 hours of life, we give this vaccine. And what we've realized is that it's important to give that vaccine right within that first 24 hours because babies get exposed to hepatitis B from any number of potential risks. Mom, potentially, if she wasn't screened later in her pregnancy. And why does that matter? 90% of children that end up getting infected with hepatitis B in their first moments of life end up developing chronic liver disease. It's a lifelong condition, not much you can do about it. So there's a rhyme to the reason of what we do. It's a very safe vaccine, and we can go through all the data on why, but really, the fact that Rand Paul, he was really, and RFK, they are the drivers of revisiting these things that no other country in the world is revisiting. But that's the concern here. And I might add, let me just point out, health systems really across the country, my own health system, while Dr. Monterez was speaking yesterday, I got an email from my health system saying, we are gonna recommend for all of our patients no changes to how we vaccinate for the respiratory viral season. America's health insurance plan said we're going to continue to cover vaccines. So there is civil society stepping in saying, you know what, we don't care what's going to happen the next 2 days. We're going to keep things as usual.
So as you said, the hepatitis B vaccine, for example, is given to newborns, and now this panel led by Kennedy wants to delay that to 4 years old. Let's just take that one vaccine as an example. Is there some new data? Are there some new medical revelations that would recommend this change?
No, and let me try to channel the contrarian view. Why are they saying this? They want to take us back, Willie, 30, 40 years ago, where they're recommending only give the vaccine if, say, mom or child might test positive. And that's what we used to do 40 years ago. We missed a lot of kids that needed the vaccine because we just didn't, screening isn't effective. You don't screen everybody. For example, mom usually has to get screened at 8 weeks of pregnancy, but there's a lot that can happen between 8 and delivery, and they can get exposed. And so there's a lot of imperfections from this screen and then vaccinate framework that we did 40 years ago, Willie, that has fallen into disfavor because we missed so many kids. And that's the expectation. The expectation is now if they remove the birth dose, here's why this matters. Vaccines for kids, for children, VFC, it's a Medicaid-funded program, Willie. Half the kids in this country get their vaccines funded at zero cost through that program. So while a private insurer is saying we're not going to make any changes and we're going to continue to fund vaccines, Medicaid is very much accountable to whatever ACIP does. So if ACIP says we're going to change the hepatitis B vaccine, it's no longer going to be covered.
NBC News medical contributor Dr. Vin Gupta, thank you very much. We'll stay on this with you. Thank you. And still ahead on Morning Joe.